the history of tariff setting in South Africa. I'll start this history by stating that private healthcare was never structurally planned. That means no act of parliament was ever passed to establish private healthcare in South Africa. It just evolved on its own as time went on. Only later was a statute passed in this regard. But this statute controlled only one aspect of private healthcare, only one side, that is the financing of healthcare, but not the provisioning of healthcare. An act of parliament, the Medical Scheme Act, was passed in 1967 and amended in 1998 as Act number 131 of 1998, which established the Council of Medical Schemes, which the chairperson is here, Dr. Mabeba, and the CEO, Dr. Gumede. No act was ever passed to regulate care providers. That means those who provide health care services every day to patients. There was never any law in South Africa that was passed to regulate them, the do's and don'ts. Even up to today, it doesn't exist. And that's why people are blaming the state. So as a consequence, tariff setting was not a structured process, thus leading to many different tariffs, which varied over time. In other words, people never knew when you go to a private practitioner, whether a specialist or a GP, anybody dealing with health, you never know exactly what is that which you are going to pay, because it's not very clear, unfortunately. So a structure called REMS, or Representative Association of Medical Schemes, was set up out of necessity by medical schemes and their administrators. And they gave this structure, REMS, or Representative Association of Medical Schemes, a responsibility of negotiating tariffs